Right, I am Dr. Avyas, and today we will discuss another disease and another chest X-ray. As we will continue our respiratory series, so today we will discuss another important disease, and this is X-ray of that disease. We will discuss how this disease will present, what will be the symptom, and what are the sign we can see on a chest X-ray. For example, this chest X-ray, I will mark a finding also. So the first thing we will see how the patient will. Can you spot abnormality? First you can see, you can mark over here. Right. I give you 5 seconds. So you can identify the pathology in this X-ray. So yes. So how the patient presented to us in this case? So the patient, came to us that he was having a productive cough and he is having a foul smelling sputum and that is tinged with blood. And but when we asked about his fever, he said and we just checked, he was not having fever and there was no weight loss. So after we performed chest X-ray and we correlated with his clinical findings and we made a diagnosis, and that diagnosis was, can you guess diagnose now? I have given you the symptom of that patient, so it can be easy. So you, with correlation with a clinical finding, you can diagnose this patient is having a bronchiectasis. So one of the important point, the important clue you can see in the patient history was foul smelling, foul smelling sputum. In bronchiectasis, the patient is having a foul smelling sputum, foul smelling. And when you do chest X-ray, you will see a tram track appearance. All right, this one, this one. So this is a classic sign of bronchiectasis. In a bronchiectasis, there is a permanent dilatation of bronchi. That's why the appearance show on chest X-ray is tram track appearance. This is a thickened bronchioles will show and will present like a tram track on a chest X-ray. So, but it's difficult. It's difficult to diagnose on a chest X-ray. So you must have to correlate clinically with the patient, because without correlation with the clinical finding, it's very difficult to diagnose on chest X-ray. But on CT, HRCT is very obvious. On some another day, if I found a HRCT of that patient, another patient, I will discuss with you. So this is a X-ray of bronchiectasis, and you can see this one the finding. So whenever a patient comes to you with foul smelling sputum, having a blood tint, uh, and there is no history of weight loss or fever, you should be suspect patient with bronchiectasis. And these are the finding on you can see on a chest X-ray. And on CT is very obvious. You can make a diagnose easily on CT as compared to chest X-ray, where you have to correlate clinically with the patient findings. Right. So today we have discussed another disease, and that was bronchiectasis.